Hi, and thank you for joining us on this quick masterclass on how Medicare works. We titled it Making Sense of Medicare. And what I'm going to try to do in this class is help you make wise decisions. You'll know more about Medicare and how it works if you watch the whole masterclass than the average agent out there. And so I have a lot of my agents. What I do is I have my agents go through this class as well so that they know and can help you better too. So without further ado, my name is Tony McDougall, and I have been in this business since 1984. And I have been the vice president of 2 national insurance companies. I've been on the field advisory board of others, and I am currently the president of SureCore Health and Financial Services Company. And I just want to tell you that so that you know that I know what I'm talking about. I've lived it. This is not something that I've read in a book. I've actually lived this. I've been in this business longer than a lot of people. And so let me run through it real quick. And let me start with some myths and misconceptions that I hear all the time from people just joining Medicare. So if that's you, let me clear up some of those myths and misconceptions that people have. Number one is that people think that Medicare is free, and it's not free. Medicare Part A is free, which we'll get into in just a minute. Part B, you still have to pay a premium every month for Medicare Part B. And number two, the next myth that I hear all the time is that Medicare pays 100%. It pays for everything. You don't have any money out of pocket. That's not the case. Medicare has deductibles and co-insurance and out-of-pocket expenses and all of that kind of stuff. So you still have all of that with Medicare. And there's no limit on how much. There's no maximum out-of-pocket expense with traditional Medicare because it's like the old indemnity plans. And then the third myth that I need to clear up that people that the government, the politicians want us to believe now is that Medicare is an entitlement program. Medicare is not an entitlement program. Medicaid is an entitlement program. Medicaid is welfare. Medicare is not welfare. Medicare is actual insurance. We paid into it all of our working life. Every month, every week, every time you got a paycheck, part of it came out in FICA taxes. Do you remember that? Do you remember seeing FICA coming out of your check? Well, part of it goes to Social Security and part of it goes to Medicare. Lately, in the last few years, they've actually split that out. And so you have a FICA tax and then you have a Medicare tax so that you can see it. But all of our life, all of our working life, we have paid into Medicare. We have paid premiums in. And so there is a thing called a Medicare trust fund. And it's there. The government is holding it in trust. It's not their money. It's our money to pay for our medical bills. And our government has borrowed money out of it many, many times over the decades and not paid it back most of the time. So that's why when you hear that Medicare is going broke and all that kind of stuff, and it's because we got a lot of baby boomers and things, it's mostly the fact that our politicians have taken our money and run with it. So I want you to understand that so that when you hear it's an entitlement program and we need to fix it, not change it, it's not an entitlement. We paid for this. This is actual insurance. It's the old-timey insurance like we used to have before all this brand new managed care came along, like when HMOs and PPOs and EPOs and POS and all these 3-letter words that the insurance companies throw at us. This is the old insurance like we used to have. You go to any doctor you wanted to, any hospital you wanted to, anywhere you wanted to go, and it just paid the bill. And there was no in-network or out-of-network or any of that kind of stuff. And that's still the way original Medicare works today. So let me just kind of run through it real quick. You have 4 parts of Medicare. Yeah, for Part A and Part B is our original Medicare. That's what they started with back in 1965. We had Part A and Part B. Part A is your hospital part. Part B is your medical part. That's your doctors and things. And Part A covers the hospital. It covers blood. It covers everything related to the hospital. It covers extended care, skilled nursing, or rehabilitation care, and it'll pay up to 100 days of that. But Part A is our hospital part. And then Part B is all the doctors and the surgeon and the anesthesiologist and the pathologist and the radiologist and all the ologists. That's Part B. That's original Medicare. That's what, when you turn 65, you automatically get Part A. And that is free. And it's not free. We paid for it all of our life. But we're not paying for it anymore after we turn 65, and you automatically get it. Part B, you have to sign up for. And Part B it costs $135 for most people. And it goes up based on income. And so I'll go into more of that in the next video. In video number 2, we'll go into the costs and deductibles and copays and all that kind of stuff. But Part A and B is original Medicare. You can go to any doctor you want to, any hospital you want to, anywhere you want to go. Part C is the Medicare Advantage plans. Medicare Advantage is you're turning over the money that the government would pay to cover you for Medicare Part A and B. You're turning that money over to an insurance company. And so instead of Medicare actually paying the bill, and when you go to a doctor or a hospital or any of that kind of stuff or have surgery, you're now deciding that you want Aetna or United Healthcare or Blue Cross or some insurance company to pay your bills now. And with that, you're going to have managed care. You're going to have an HMO or a PPO or something like that. And so you're going to have a list of doctors and all that kind of stuff. And Medicare Advantage plans have to pay at least what original Medicare would have paid had you stayed on that. And so when you sign up for a Medicare Advantage plan, you no longer have Medicare paying, you have an insurance company paying. Does that make sense? Okay. And then Part D is the outpatient prescription drug coverage. And again, that is you're having an insurance company pay that. You're picking an insurance company to pay for your prescription drugs on an outpatient basis. So that's original. I mean, that's the way Medicare works. You have Part A, Part B, Part C, and Part D. And with in the next video, we'll go into more of that in detail and kind of explain that. Also, in the next video, we'll talk about Medigap plans. With a Medicare if you keep original Medicare, you can get a Medigap plan to pick up what Medicare doesn't pay. So with original Medicare and a good Medicare supplement, you end up with very little money out of pocket and sometimes no money out of pocket if you get the right Medigap plan, Medicare supplement plan. So with a Medicare Advantage plan, Part C, you can't get a gap plan, a Medigap plan to pick up what the insurance company is not going to pay. So anyway, I don't want to go into that in too detail. I've already gone way over on this video. So we'll go ahead and cut this video. And in the next video, we're going to talk about how much Medicare costs, how to sign up for it, and all of that kind of stuff. So I'll see you then. Thanks for watching, and I'll see you in the next video. Bye.